So in this session, we'll deal with the pancreas. Pancreas histology. So pancreas is located retroperitoneally, extending from concavity of the duodenum to the hilus of the spleen. Pancreas shows head, neck, body, and tail. And there will be pancreatic ducts. The main pancreatic duct is called as duct of Wirsung, and there will be an accessory pancreatic duct which is called as duct of Santorini. So you can see here, these are the right and left hepatic ducts, common hepatic duct. You can see the gallbladder with the cystic duct. Cystic duct joins with the common hepatic duct to form the common bile duct. Common bile duct joins with the main pancreatic duct to form the ampulla of Vetter, which is guarded by the sphincter of Oddi and opens at the major duodenal papilla. Here you can see the accessory pancreatic duct or duct of Santorini, which opens at the minor duodenal papilla. So histology of pancreas, it will have a capsule, a thin layer of loose connective tissue, forms a capsule of pancreas. Septa extend from capsule into the substance of the gland and divide the parenchyma of the gland into ill-defined lobules. Parenchyma of the pancreas is divided into two components according to its function, namely the exocrine pancreas and endocrine pancreates, which have islets of Langerhans. So exocrine pancreas is a compound tubuloalveolar serous gland. So pancreatic acines or serous acines, round or oval in cross section with small lumen. Lining epithelium is simple columnar epithelium having narrow luminal surface and broad basal surface. Nuclei are spherical and basally placed. HND staining, secretory cells show basal basophilia and apical eosinophilia. Basal basophilia is due to rough endoplasmic reticulum, whereas apical eosinophilia is due to numerous secretory vesicles, germinal granules, and Golgi apparatus. And there will be centroacinar cells. So these centroacinar cells are the cells which line the beginning of the intercalated ducts. So intercalated ducts are the intralobular ducts which drain into interlobular ducts. So intercalated ducts are the intralobular ducts and which will drain into the interlobular ducts, and ultimately they drain into the main and accessory pancreatic ducts. Intercalated duct, these are intralobular ducts that begin as centroacinar cells. So they are lined with simple squamous to very low simple cuboidal epithelium. There are no striated ducts in pancreas. Striated ducts are present in parotid gland. Intercalated ducts open into interlobular ducts that are lined by cuboidal or low columnar epithelium. Main and accessory pancreatic ducts are lined by simple columnar epithelium. You can see here, this is the exocrine part where you are seeing the pancreatic acini. Here, this is the endocrine part where you are seeing the islets of Langerhans. These are the enlarged islets of Langerhans. You can see the intercalated duct, and you can see the pancreatic acinus, serous acinus with the centroacinar cells. So these are the cells which line the beginning of the intercalated duct. So you can see here, this is the secretory acinus. You can see the intercalated duct beginning, which is lined by the centroacinar cells. So each acinus in the center, they will show lumen. Along the lumen, they will show the centroacinar cells. So they will secrete into the intercalated duct, which will drain to the interlobular duct, which ends in the main and accessory pancreatic ducts. Endocrine pancreas consists of numerous small clusters, groups of cells or islands that are scattered in the parenchyma of the pancreas. So these islets are absent in parotid gland. So that's how we can differentiate. Like striated ducts are present in the parotid gland, islets of Langerhans are present in the pancreas. Centroacinar cells are not present in the parotid gland. Centroacinar cells are present in the pancreas. So these clusters of cells are called as islets of Langerhans. So human pancreas contains about 1 million islets, about 1 to 2% of the volume of pancreas. So, so if you see the HND staining, the islets of Langerhans consists of clusters of pale staining polygonal cells with numerous capillaries. These islets are surrounded by serous pancreatic acini. So in HLD staining, we cannot differentiate different cells, different types of cells. But in malaria agent staining with Zenker's formalin fixation, there are three basic types of cells, namely the red A or alpha cells, then brownish orange B or beta cells, and blue D or delta cells. So immunohistochemical staining method, in addition to alpha, beta, and delta, islets of Langerhans shows few other cells such as F cells, PP cells, D1 cells, and enterochromaffin cells. So you can see here, these are the A cells which are located at, more at the periphery, around 15%. So which secrete the glucagon, and here you can see the B cells which are brownish, which are located at the center. These are around 70% and they secrete insulin, beta cells. And these are the D cells or delta cells. So alpha cells, beta cells, and delta cells again, which are located at the periphery, around 15%. They secrete somatostatin, which will inhibit the secretion of both insulin and glucagon. Glucagon will increase the sugar level, whereas insulin will reduce the glucose level. So you can see here, these are the pancreatic acini, these are the pancreatic islets. So this is the pancreatic islet. These are more concentrated towards the tail of the pancreas. So that's why during surgery, splenectomy, if accidentally tail of pancreas is removed, it will be resulting in very severe form of diabetes. So now if you see the different cells, like alpha cells are A cells, otherwise called A2 cells. They secrete glucagon, constitute about 15 to 20% of the cells of islets, arranged towards periphery of the islet, stained brightly with acid fuchsin. Then beta cells or B cells, they secrete insulin, constitute about 60 to 70% of the cells of islets, arranged in the center, stained with aldehyde fuchsin. Stained with aldehyde fuchsin. Then delta cells or D cells, which are the type 3 cells, also called as A1 cells. They secrete somatostatin, constitutes about 5 to 10% of the cells of islets, peripherally placed. Then these are argyrophilic cells, stains with silver. They also stain with acid fuchsin. Then PP cells or pancreatic polypeptide cells or F cells. Then D1 cells, which secrete vasoactive intestinal peptide, and enterochromaffin cells, which secrete serotonin, motilin, and substance P. So acute pancreatitis is an acute medical emergency, which is like life-threatening conditions where the pancreatic digestive enzymes are released into the blood, and whenever they come in contact with the surfaces, they start digesting at any organ, which results in multi-organ failure. In chronic pancreatitis, if you see serum amylase and serum lipase levels get elevated both in acute and chronic pancreatitis. Then diabetes mellitus. Diabetes mellitus, now you are seeing this is one of the largest evolved non-communicable disease which will have life-threatening complications if left untreated. So now you can see overview. Exocrine pancreas secretes bicarbonates and digestive enzymes. Serous acne, simple columnar cells with basophilia, apical eosinophilia, centroacnar cells lined, which lines the intercalated cells. And interlobular ducts lined by simple cuboidal low columnar epithelium. Main and accessory pancreatic ducts lined by simple columnar epithelium. So endocrine pancreas will have light staining clusters of polygonal cells, which mainly have alpha cells which secrete glucagon, beta cells which secrete insulin, delta cells which secrete somatostatin, and supplied by fenestrated capillaries. Thank you.